Dr. Jason Lee, clinical instructor in medicine, University of Connecticut Health Center, and attending physician, Hartford Hospital, will talk about the examination of the head, eyes, ears, nose, and throat. Welcome, Dr. Lee.
Thank you.
I have several questions that I want to ask you about this difficult part of the examination. Is there a feature in the general appearance or facial appearance or even the eyes of a patient that should point us generalists toward an allergic cause of symptoms, whether they're ocular, nasal, sinus, or other, as distinct from our usual struggle to decide is it allergic or is it infectious, and if infectious, is it bacterial or viral?
Well, there are some of the features that you can look for when you are seeing the patients, especially when you're taking the history. You can just look at the patient that may tell us whether that patient may or may not have allergies. You can look for redness in the conjunctiva. You can look for shiners below both eyes to see whether they have any of that. Or in kids especially, you can also look for the creases over the nose from what are called allergic salutes. When the kids rub their noses all the time, they may cause a crease over the nose. And these are some of the things that you can look for to see whether they have allergies. Although not perfect, sometimes you'll find these features in people with allergies.
If I can change gears abruptly to some other facets of head, eye, ear, nose, and throat examination, do you advocate palpation of the mouth with a gloved hand to assess for intraoral masses and ulcers?
I think that's important in part of the oral examination, and especially in people who have a history or a risk of developing any kind of oral cancers, then it's very important to palpate the mouth for any kind of tumors or ulcers.
And certainly the fact that the dentist does it doesn't absolve us, because the contact may be with the physician first.
Correct.
I'd like to add one observation, but to test it against your knowledge base, and that is, my understanding is that for oral cancers in smoker drinkers, who are the highest risk common group, it is not the dorsum of the tongue which is the most accessible, but rather the side of the tongue and the floor of the mouth under the tongue that have the highest yield for cancer. So perhaps we would add the caveat, not only gloved finger, but also a glove and a gauze to pull the tongue aside and get a good view underneath it. Is that correct?
Yes, that is very important to do also, yes.
The thyroid is always, for me, the toughest part of the HEENT exam. For a long time, I ausculted thyroids, listening for bruits that would be indicative of Graves' disease or thyroid carcinoma. Is that something that you do?
I think that I used to do that in the beginning. However, I rarely do that anymore. In some patients, when I'm really suspecting Graves, I may try that, but the yield has not been that great for me, so I tend not to do that anymore.
And I'd like to ask you a very open-ended question before I ask you about your technique in examination of the thyroid, and that is this. We test thyroid function so readily and accurately with our supersensitive TSH. Is there still a role for physical examination of the thyroid in the third millennium?
I think there is, and let me show you how I do my thyroid exam.
Thanks so much.
Okay, so I'll be doing the HEENT examination today. Hi, I'm Dr. Lee. Nice to meet you. And before starting the examination, it's also important to inspect the overall patient to see if there's any abnormal findings. And after you're done with the inspection, you can go ahead and start doing the examination. What I like to do is usually start examining the eye. Normally, when you're looking at the fundi, you want to dim the lights to allow the pupil to dilate, so you can look into the retina a little better. But for this demonstration, I'm just going to do the exam with the light on. You can start by shining the light on the. You can actually take a point on the wall and look straight ahead, please. Shine the light in the eye, and as you get after you get the red reflex, you can get closer to the eye, look at the disc and vessels in the eye, and you would move to the other side to look at the other eye, but you want to use your left eye to look at the left eye of the patient. Look at the left eye with using your left eye and get closer. You can also examine the lid. You can look at the conjunctiva by pulling down the lid also at the same time. After you're done with that, you can go on to the examination of the ear. Of course, you need to look at the ear and look for the abnormalities, and then you can go ahead and look inside the ear for tympanic membranes. And you can also use the same speculum or nasal speculum to examine the nose, inside the nose. You can insert the speculum into the nose with the light and examine the interior of the nose. Next, you can move on to the examination of the mouth. Open your mouth, please. And shine a light. Look at the inside. Look for any abnormalities of the tongue or the teeth or the gums. And then you can look at by using a tongue depressor. Say ah, please. Ah. You can examine the posterior pharynx and also movement of the uvula as patients say ah. Now you can, when you're done with the mouth examination, you can go on to the examination of the neck by palpating under the mandible for any nodes or posterior auricular nodes. You can also examine the thyroid from the front by palpating, and also examine for the supraclavicular nodes. Now, you can also examine the thyroid from behind, and when you examine the thyroid, you can have the patient take a sip of water, and go ahead and take a sip, please. And as you're palpating, you can feel the thyroid moving. You can press on the thyroid and trachea on one side and feel the thyroid rising on the other side. Go ahead and take another sip, please. And you can do the same thing for the other side. And that is it for the HENT examination.